The opioid crisis is one of the biggest stories in the US. Tens of thousands of Americans are dying from opioid overdoses. That's the story you've heard. So, how about the story you haven't heard? Why is the FDA cracking down on a substance that some say is helping save so many lives? Has the agency actually been involved in a massive disinformation campaign against a substance called Kratom? So, what is Kratom, and why is the FDA fighting so hard against it? Let's give it a reality check you won't get anywhere else.
Reality Check with Ben Swann, powered by Dash Digital Cash.
Another White House administration is making fighting the opioid epidemic a top priority. And again, the focus is on the wrong thing. What if, while ignoring the root causes of the opioid epidemic, the FDA is also fighting the substance that is saving people's lives who suffer from opioid addiction? Now, before we can answer that question, let's talk about the substance the FDA is looking to ban. It's called Kratom. So what exactly is Kratom? Well, Kratom is a tropical tree in the coffee family. It's commonly used in a raw plant form, with the dried leaves used to make a tea or crushed and then mixed with food. It's indigenous to Southeast Asia, and that plant has become a popular natural medicine right here in the US. So, how popular is Kratom? Well, actually, millions of people around the world take it for chronic pain, alcohol addiction, weaning off of opiates, depression, anxiety, PTSD. There's a very long list, and there's a lot more. But the FDA says Kratom is actually just as dangerous as opioids. In fact, in November, the FDA commissioner recommended that Kratom be scheduled as a Schedule 1 drug, meaning it is highly addictive and has no proven medical value. In addition, the FDA claims that Kratom is responsible for 36 deaths. Listen.
We're holding it at the border. We've impounded hundreds of thousands of pounds of this substance, but a lot of it's coming into the U.S. regardless. We've had concerns about this for a long time. The DEA tried to schedule it in 2016. And we're currently working with the DEA to look at a scheduling process now. We're coming up with what we call an 8-factor analysis, which assesses the product. We've made that available to the DEA and for their consideration. They'll make a scheduling decision based on our analysis.
But here's the problem. Just days ago, 9 leading scientists in substance addiction and safety, they wrote to the White House opioid crisis team leader, Kellyanne Conway, and the acting DEA administrator, Robert Patterson. And they encouraged both to disregard the FDA's claims about Kratom, pointing out serious flaws in the agency's claims. For instance, the scientists warned that 4 surveys indicate that Kratom is presently serving as a lifeline away from strong, often dangerous opioids for many of the several million Americans who use Kratom. A ban on Kratom that would be imposed by CSA scheduling would actually put them at risk of relapse to opioid use, with the potential consequence of overdose death. Similar unintended consequences are to be expected in some who would be forced to use opioids to manage acute or chronic pain. Now, these scientists went on to challenge the claims by the FDA by pointing out that available science is clear that Kratom, although having effects on opioid receptors in the brain, is distinct from classical opioids like morphine and heroin and oxycodone in its chemistry, they say, biological effects, and origin. Again, Kratom is not poppy-based. It is a tree in the coffee family, and therefore it has a reportedly milder euphoric effect than traditional opioids and opiates. The other, though, important rebuttal that these scientists made was to point out that the FDA used significantly flawed information when it claimed that Kratom was responsible for 36 deaths. Quote, the fatalities that the FDA lists as having been associated with Kratom include deaths with a wide variety of apparent causes in people suffering from various diseases and or taking other substances that also likely contributed to their deaths. For example, it includes 9 fatalities in Sweden that resulted from an adulterated product that included the active substance of the prescription opioid tramadol. So in response, last week, the FDA commissioner released more information on those who have died. The agency says, again, from Kratom. But that information was even more stunning. According to HuffPo, almost all the FDA's cases involve subjects who were found to be on multiple substances at the time of their death, with the vast majority including either illicit or prescription drugs that carry well-known fatal risks. The FDA's list of Kratom-related deaths, it includes a 43-year-old man determined to have died from complications due to deep vein thrombosis. He had a long list of medical problems. At the time of his death, he had recently been prescribed 5 different medicines. His toxicology test, it came back positive for opioids, Xanax, antidepressants, and a medication apparently used to treat his Tourette's syndrome. He also tested positive for Kratom. Now, one case also involves a man who had fallen out of a window, broken his arm, and refused treatment before dying. He was ultimately found to have 9 different substances in his bloodstream, among them the primary psychoactive substance in Kratom. Now, one case the FDA listed as a Kratom-related death, which has been completely redacted in the document, by the way, appears elsewhere in an agency database as a death by homicide due to a gunshot wound to the chest. So why is the FDA doing this? Well, we don't know the motives of the FDA, but as I've shown you in the past, the FDA suffers from severe conflicts of interest, especially when it comes to the revolving door between the agency and Big Pharma. With the government spending more than $500 billion per year to fight the opioid epidemic, you could assume that there are lines of pharmaceutical companies looking for product alternatives. But remember that any naturally occurring substance like Kratom, it cannot be privately patented. So there's no real profit for the big pharma companies in Kratom. In this interview on CNBC, the FDA commissioner does actually reinforce that suspicion. Listen.
We know that there's a lot of good therapy already on the market. There's 3 approved drugs that help treat opioid addiction, and we're open to looking at new products. And so we are putting out additional guidance documents and policies to try to create a bigger market for people who want to come in and develop products to treat opioid addiction. We don't think Kratom is one of those products.
So what you need to know is that while I won't speculate about what the FDA is ultimately trying to do, I can tell you what the FDA wants done. The agency wants Kratom to become subject to an FDA new drug application. To be clear, they say a naturally occurring plant taken in its raw form that's helping millions of people right now needs to be banned and become subject to a study that would take no less than 10 years and could cost up to $2.5 billion. More importantly, what the FDA is recommending is exactly the opposite of the agency's charge. There is no evidence that Kratom on its own is harming anyone. And so the question remains, if the FDA is successful, will the agency actually push millions of people toward more dangerous alternatives, including harmful opioids? And if so, how is that making the fight against opioid abuse a priority? That's Reality Check. Let's talk about it right now on Twitter and Facebook.